Just knowing that we are helping people be healthier, I think that's the greatest feedback of all.
The early Delta assessments really pulled us together as team members and allowed us to do operational reviews and evaluations within each of our departments. It identified a couple of larger projects that we were able to work on through the grant.
We started looking at our county health statistics and our obesity levels and healthy lifestyle activity levels were significantly worse than the state averages.
In this area, some of the special needs that we have that are really difficult for us to get help with is mental health and also obesity are two big concerns in the community, which are through a lot of communities when you look at them. I don't think we're unique necessarily in that way, but two of those things, a lot of people don't realize how they're actually interconnected. If they're not able to lose weight and they're not acting healthy, then that affects your mental health. Your mental health also affects your weight. If we can exercise and we can have good nutrition and we can provide those platforms for people to follow, that can help with both of those. It's been shown that good nutrition and exercise helps your mental health tremendously.
And so we were able to work with the Delta program to start to have a priority planning event to bring in community partners, look at those statistics and figure out how can we fix this problem? What can we do? What steps can we take to start looking and fixing this problem? And they were just really instrumental in helping pull all that together.
Building those relationships and making those time investments to reach out to them and partner with them on the different projects that we're going to work on going forward. The Delta grant just gives you that resource and extra push to kind of put that as a high priority item for your organization.
We all talked here at the hospital as a staff about who we wanted as community partners. And while the health department and the school district were obvious choices, we also wanted some members of the community who maybe didn't necessarily have anything to do with healthcare. We have local banks, presidents and vice presidents on our committee. We have media people on our committee. I think you need all those personalities. I think in a small community, everyone has a different skill set and everybody has a different reach. And so I think it's important to pull all of those people together.
Our mind is more powerful than anything that I can give you as a medication-wise or that I can do for you. And we have to be able to tap into that and get people to realize that a lot of our circumstances we can change and we can fix if we just tweak a few little things.
For example, our Move Madison County project we're working on right now is a marathon through May, where we're encouraging people to walk 26 miles in the month of May. We had over 130 people sign up for our group because our community partners invited their friends, their coworkers to get involved. And if we were doing that by ourselves or just with the health department or, some of those obvious choices, I don't think we would have gotten that many people involved. I had someone post this morning in our Move Madison County group that they went for a walk last night and they got 3 miles in, and the only reason that they went for a walk was because of this challenge and they had this accountability, and so they said thanks for the motivation.
Anybody that's in healthcare knows that it's ever changing and there's always something new on the horizon that you need to change and adapt for. So the Delta program helped us grow financially to be more sustainable in those areas so that we can adapt in the future. The Delta program gives us a chance to kind of see those evaluations through and then the implementation and the assessments on the back end. That fresh set of eyes for us has been invaluable.